Stillbirths are defined as when the child is born without any signs of life at or after 24 weeks of pregnancy. So that basically comes under the definition of stillbirths. Now, whenever we are talking about the stillbirths, they can be classified into the intrauterine deaths as well as the intrapartum deaths. Talking about the intrauterine deaths, that basically occurs within the mother and the delivery has not taken place, then it is known as the intrauterine death. And the intrapartum death basically occurs due to the complications of the delivery itself. So that basically comes under the definition of the intrapartum death. So that is how basically you classify these stillbirths. And now how can you differentiate these stillbirths from the live births? Live births, basically a live infant has its own signs of living, his own signs of existence, and that has to be looked for whenever we are establishing a live birth. So in this section, we'll be dealing with how one can differentiate between a stillbirth and a live birth at this level. Now, the incidence of stillbirth is rising in a lot of developing countries just due to the lack of proper care that is given to the mother, even during the mother as well as the infant, even during the intrauterine life, and even the delivery consequences and the infectious states that can develop during the delivery states that can lead to the death of the child as well as the death of the mother. So these are the consequences that can occur, and the role of the pathologist while he's establishing this stillbirth is again very important, or even if he's establishing the existence, then again, or the live birth, it's again very important. As a pathologist, if you're working and you're establishing it or advocating it, how can you go for it? Now, stillbirths, live births, and separate existence, now these are the different terminologies that are being commonly used over here. And so we'll be discussing the definitions one by one and the terminologies that are given and the particulars that are given to these states. The concealment of birth or the concealment of a stillbirth as well as the concealment of a live birth, they usually come under the legal consequences. Because it is the duty as when you are the resident of any country, it is your duty not to hide a stillbirth as well as not to hide the live birth. So if the stillbirth or the live births are concealed, then it is considered to be a crime. So that is not going to happen, and it comes under the legal definitions. Now, the incidence of the child homicide is basically discussed over here. Many cases, they remain undetected because they are unreported. So working as a medico-legal officer or who is conducting deliveries, one should have a complete record of the stillbirths as well as the live births, because it is the duty of a medico-legal officer to do all of these. Now, filicide is basically the deliberate killing of one's own child. So this is basically the terminology where it is used when one's own child is deliberately killed. It comes under the definition of filicide. There is no age limit, but the child should be a minor at this level, and if one is killing one's own child, then it comes under this definition. Now, moving on to the infanticide, obviously it's basically the killing of the child, it's basically the child homicide, and the age limit is 12 months or 1 year. So the time following the childbirth, and it is mostly limited to 12 months, starting from the birth till 12 months, it's basically the infancy period. And any killing that comes under this infancy period comes under the terminology of infanticide. Now, talking about another terminology that is known as the neonaticide. It is the subgroup of infanticide and the homicide of the newborn child and the child within 24 hours of life. That basically comes under the neonatal lifespan, that is 24 hours of life, and any killing between this period comes under the heading of the neonaticide. So that is basically the different terminologies: filicide, infanticide, and neonaticide. These are the different terminologies and one should be familiar with them. Now, stillbirths, whenever we talk about them, there are no signs of life after birth, and especially we are talking about after the fetus has attained the age of viability, that is 24 weeks. So death can occur before the complete expulsion, that will be considered as the intrauterine death, and death occurs in utero during the early stages of parturition. That basically comes under the terminology of intrapartum death, or due to the delivery complications. The child can die due to the delivery stress complications that can occur during the delivery process or the procedure. Now, fetal losses, they are defined as the miscarriages that can occur over here. And so the regional variations in the preterm births, there are basically, according to the region or according to the country that we are talking about, there are variations in the preterm birth. The records have been different, and different researches have been carried out due to the causations of the causative factors or the risk factors for these stillbirths. Now, the functions of pathologist in infanticide: assistance in identifying the mother. Of course, it's again very important to personally identify the mother, as well as the estimation of the maturity of life of the child. So there are different signs that have to be looked for, just to, even if it is an intrauterine death, the gestational weeks have to be calculated. So that is basically the duty of a functioning pathologist, whosoever is working on that case, on that particular case, the determination whether or not the child was stillborn. So there are particular signs for this stillborn and the live births, and they have to be differentiated by the pathologist. Determining whether death was due to the natural causes or omission or commission. So omission and commission, they are basically the legal terminologies. Omission again can come under the neglect phases on the part of the doctor. So commission is again if something that was not required and that was committed by the medical officer, whosoever was conducting the delivery, that comes under the definition of commission. So omission and commission can both come under the terminologies of the neglect on the part of a doctor or the medical practitioner. So again, the pathologists have to look for the signs of any omission or commission or neglect on the part of the medical team who was working or who's carrying out the delivery process. Live births and separate existence have to be basically differentiated. The converse of stillbirths, it's basically the live birth, and synonymous with separate existence. Now, the separate existence is basically established when the infant is issued forth from the mother. He's completely expelled out, and it is irrespective of the gestational age. If the viability age has been attained or not, it is irrespective of that. And the infant basically shows the signs of life. So that is basically the complete definition, and if the criteria is fulfilled, then it comes under the terminology of separate existence. The child crying lustily, foot is still in the vagina of the mother, and the live born but not the separate existence has developed. So the child has to be completely expelled out. That is the mainstay over here, that the infant is issued from the mother. Now, the age of viability, it is the potential ability of an infant to survive after birth, and the immature fetus may be born alive, and there is no independent or no separate existence over here established. The stage of gestation varies, and it has to be calculated by the pathologist, whosoever is conducting the investigations. And usually the age of viability, when we are talking about it, it's almost 24 weeks or after that. That basically comes under the viability age. Now, concealment of birth is defined as the crime is the hiding of the body to conceal the fact of the birth, whether it doesn't depend at all on live birth, separate existence, or viability. So it can be the stillbirth or it can be the live birth on the other hand, but it cannot be concealed, it cannot be hidden, and the fact has to be there according to the death certificates of the child. If it is a stillborn baby, there is a separate death documents that have to be handed over to the state as well as to the relatives. That should not be hidden, and it is basically a crime, relatively minor crime in most jurisdictions. And dead body is not notified to the authorities. Noticing stage of the gestation, it is, or calculating the stage of gestation, it is again very important over here. And no examination of the dead infants is carried out whenever the concealment of the dead births or the live births is carried out. So, in this section, basically, we dealt with the different terminologies that are being used whenever the stillbirths occur, and how are we going to differentiate the stillbirths from the live births. That is the end to this section. Thank you for watching sqadia.com.